When you go into medication, the screen is going to look like this. You can search based on a brand name, or you can search based on a generic name. For example, if I search based on a brand name, whatever that matches that up will be brought in. On the other hand, let's say I search based on a generic name, then all those drugs which contain this particular composition, all of that will be displayed. And let's assume I pick up a particular drug, then for that drug, there could be multiple variants of that drug. So if you see, this is the drug that you have picked up, and it says this is paracetamol 200 mg, and on that, these are all the variants which are available, and you can pick up any of this. So you can actually pick this up, and accordingly, it will change here, and also you can see that the price that is associated with this also would change. So you can pick up those medications that are appropriate. You can search based on a generic name. You can search based on a brand name here, and that will be displayed. Then once the medication is picked up, then you would enter the frequency here. So you would say whether this is daily. So I would want, let's assume you want the patient to take this on a daily basis. So you will pick up every day, and frequency is thrice a day, and how many units you want the patient to consume at a time. So you would say every time there's only 1 unit, and you want the patient to do this for 5 days. So the moment you say 5 days, and you see that there is a total quantity which is calculated depending on, when you say 1 unit thrice a day, which means it is 3 units, 3 tablets in a day into 5, that will make it 15. So the system will calculate how many of such tablets, or in this case I think it's a suppository, is required. So this will be automatically calculated. So once you enter this, you go ahead, press the save button. So it will get saved to this prescription onto the right. It is possible to do a tapering down of the dosage. Let's assume you pick up a medication, methotrexate. Once you pick up this medication, whatever the variants of this medication that's available will be listed down. So as you can see, there are multiple variants of this medication that's available. You can go ahead and pick up any variant, and for that variant, I say the frequency is daily, and probably twice a day, and the duration is going to be for 5 days. So it calculates the 10 quantity, and then I say then I taper it down once a day for 3 days. So you can see that the total quantity is calculated 10 and 3. So when you go ahead and save this particular medicine into the prescription, so you can see that there are 2 entries for methotrexate to indicate that it is a tapering down dosage. And whatever that you have entered here in the prescription, you will be in a position to go ahead and save that as a prescription template. So you can search for a template to append it to the existing prescription, or if you want, you can go ahead and create a new template. So click on the create button, and enter the name of the template, and then click on save. So whatever that you have entered in your prescription will be saved under this particular template name, and this will be available for subsequent use when you want to use it with any other patients or with the same patient also. And it's also possible for you to pick up templates which are already created and then append it to your current prescription. So let's assume in this case we pick up this template, and you have the option to append or override. So when you override, your existing prescription will be overwritten with the template medications, or you can append in this case. So whatever drugs that you have already entered will still be there, and then the other medications from the template will be added. And then you will be in a position to go ahead and print the prescription. Once you print the prescription, you will see that it comes up with all the header information of the patient, along with that the allergies, what's the primary and the secondary diagnosis, and subsequent to that, if there are any insurance details associated with the patient, that will also be displayed here. And then you will see all the drugs that you had to return in the same order of that you had written. Then if you see methotrexate, then you will see two entries which shows that it is a tapering down, but the total quantity will be calculated based on the two different administration advices. And from here you'll be able to spool that to the printer. So this is how you would typically write a prescription. So as a physician who would want to do a simple process flow, once you are in the EMR, just go to the journey tab. When you click on the journey tab, you will know what are the past medical records of this particular patient. And then you would go into the diagnosis tab, and from here you would enter what is typically it's a soap form, and then you would go into the medication to write your prescriptions. And once you write your prescription, you print the prescription, and then you are good to go. You'll be able to save this visit, and then go ahead with the subsequent patients.